I'm very excited to get to know more about you. I've obviously seen a lot of the videos and content that you're posting on X, um, but I think a lot of people are interested in your story and many of the patient stories from Neuralink.
Yeah,
So,
sure.
as much as you're willing to share, I think it'd be really great for them to hear.
Yeah. So I guess I can just start with when I discovered that I have ALS. So um, my symptom onset was not typical. Most ALS patients' symptoms start in their legs, so they start tripping over themselves. Or if it originates in the arms, it tends to be more in the hands or fingers, more distally. So people are typically, dropping things, fumbling pens, that sort of thing. Um, my symptom onset began as I developed this muscle fasciculation or muscle twitch in my left bicep. It was very bizarre. I wrote it off as, dehydration, maybe drink some more water. It didn't really have an effect on me at all, other than, I looked down at my arm and I could see it pulsating, and it was a nonstop twitch. It was constant. Um, so I let this go for 4 to 6 months before I was like, okay, this thing is not going away. It wasn't spreading at all. It was just this twitch confined in my left bicep. So I went and saw my primary care physician. He was unaware of what was going on, so he referred me to a specialist, a neurologist. Um, so I went and saw this neurologist, and the baseline visit, he was like, muscle fasciculations can be anything from a pinched nerve to dehydration to a hernia. And then when you work your way down the line of things it could be, then we're talking Alzheimer's, ALS, MS, that sort of thing. He said, I won't know for certain what we're dealing with until I'm able to run an EMG on you. So let's schedule a follow up. You come back and we'll do the EMG. I had a very busy work schedule at the time. I was a surgical device rep for one of the leading women's healthcare companies on the planet. So I was in and out of the operating room and hospital setting every single day. But I found a company holiday, President's Day of 2022. So I went back for that follow up visit, and the doctor ran the EMG, which the EMG test, I don't know if you're familiar. The first part of the test is they send shocks through your limbs to see how the nerves respond. And then the second part is they stick needles in the different parts of your muscles and try and listen for some sort of feedback. Um, the EMG test came back conclusive that I'm someone that has ALS. Probable ALS was the diagnosis. And this was on February 21st, 2022. I was 31 years old at the time, otherwise completely healthy. Never had, you know, any real health concerns at all. Um, and so that day I was told that I have about 2 to 5 years to live, which, how do you quantify that, as a human being going from, and at the time I just built a house. I had received a promotion at my job. I had a 2-month-old son at the time. So like things were really going my way. I felt like I was really stepping and walking with momentum in my life, as I was climbing to achieve my goals. And then just out of nowhere, I received this diagnosis that ALS diagnosis is a diagnosis of exclusion. So you try and find other things that it could be before you arrive at the final conclusion of ALS. So my initial instinct was denial, reject. This can't be true. I sought out second opinion, third opinion, fourth opinion, traveled the country seeing doctors at Duke, Stanford, Mayo Clinic, uh, the national. I went to the NIH to have my entire genome mapped. No one could give me any real other answers than you have ALS. And all of the neurologists that I went for the second opinion, third opinion, it's hard to really exclude that bias once it's introduced. So once I had that positive ALS diagnosis in my file, every physician I went to after that, I wouldn't say they seemed dismissive, but they were not going to be the guy that was going to go against an ALS diagnosis. So all of them pretty much agreed. They all ran their own EMG, all came back with the same conclusion. Um, so that was my diagnosis in February of 22. And for the next year or so, I didn't have any progression of that muscle twitch. It stayed in that position of the arm. I was traveling a lot. I was working all the time. It was kind of like out of sight, out of mind. I was in complete denial that if I wasn't at home and people that I was working with didn't know I had it, then I didn't have it. So that's how I was living my life for that year after I was diagnosed. And then slowly but surely, I would notice that I'd be at the hospital getting dressed and my scrubs were harder to tie. I'd be putting my surgical mask on, and reaching behind my head and tying a mask was more difficult. Um, I would notice, I traveled a lot of the places by plane, so I would have a carry-on. And I noticed that my carry-on was slowly getting heavier, harder to get in and out of the overhead. Things just started in my shoulders where things just started to seem more heavy. Um, and then from there, the floodgates were kind of opened in the sense that it quickly spread from my shoulders where I couldn't really lift anything of substantial weight, anything over 5 pounds, really, I was struggling with. And then I slowly noticed it spread to my hands to the point where I couldn't really grip anything anymore. I couldn't grip a pen to write. Um, I could no longer type. So if I wanted to send a message or an email, I would have to stand up and peck to type on my keyboard. It was very cumbersome, and the whole time you're thinking to yourself, okay, you were young and now you're in this position where everything is kind of being stripped away from you slowly but surely. And all of the physicians that I went to, there are currently 2 FDA-approved ALS drugs that are on the market. I'm currently prescribed and taking both of them. So outside of those 2 drugs that are on the market, every neurologist was like, come back and see us in 3 months and we'll see where you're at. There's no real treatment protocol set up for ALS patients other than come back and see us in 3 months and we'll see if you've declined anymore. So, with my back against the wall, I started looking for options, and there were a couple clinical drug trials that were going on. So, I enrolled in a clinical drug trial, and I was in it for the 24 weeks for the protocol. Came back, the data came back completely insignificant. So the drug was really ineffective. And I got to thinking to myself that the medical community, it seems that we're no closer to a cure today than we were 100 years ago. And so I thought to myself, if time is truly my greatest asset, and if the medical community is not going to help me out, then I need to start looking for alternative answers. And that's when I stumbled upon Neuralink. Um, I've lived here. I've lived here in Austin, Texas, um, and I think I saw a news spot. I think I saw Nolan on the news, and they were talking about P1 and the great things that Neuralink could do. So I remember going to their website. This was probably 6 to 8 months ago, and I went to the patient registry, and I recall at the time the inclusion criteria was a little bit more strict and a little bit tighter than it is now. Um, but I indicated, I have received an ALS diagnosis. I do have partial paralysis in my arms. My legs, I can still walk, kind of. But if I leave the house, I definitely bring my power chair with me. So I listed all these things in the patient registry, not really thinking, that I would hear back. Um, and in April, I was contacted by Neuralink and by the research team at Barrow, and that's when we started the interview process. And then I went out to Phoenix to do a couple days of in-person testing. Um, and then I came back to Austin, and a couple weeks later, I heard that I was selected to be patient number 7 for the Neuralink BCI. And that moment for me was pretty profound in the sense that, like, for the last 3 years, whenever I've received calls regarding my health, I've always ended the phone call in disappointment, you know? And this was the first time that, you know, it felt like a gift from God, honestly, receiving that phone call saying I was selected. Um, so I was over the moon, ecstatic. And then I received the implant. The implant, I had the procedure on June 13th. So just a little over 2 months ago at this point. And I honestly can't even remember what it was like before Neuralink at this point because I'm not I'm not missing texts because I'm not responding to them. I'm so much more engaged with everything that's going on that I went from not being able to really interact with anyone unless they were face to face or on speakerphone because I couldn't really handle fumbling my phone in my hands. Um, Texting anything more than a word or two was really hard. And now I feel like I can fly around a computer almost faster than I could before my diagnosis, back when I was perfectly healthy. Um, I feel that confident in this technology and the models that I've been working with that I don't have any real struggles navigating the internet, sending messages, replying to things. Um, it's really changed my life in a way that, things are just, today's the best day that I'll be, like I was better yesterday than I am today. I'm better today than I will be tomorrow. That's the disease talking. But with the Neuralink, I think in terms of what are we going to learn or what are we going to accomplish today? I'm not waking up with that dread and that hopelessness that I was before. Like working with this Neuralink team every day truly gives me excitement. And, every single day we're finding out new things, or I'm hitting a new speed record, or like it just brings me so much joy in what we're accomplishing now, and what it will mean for millions of people moving forward, as we perfect this technology. I feel like I just dumped a lot on you.
Yeah, very much appreciate you sharing all that. It's difficult to hear. Obviously, the things that Neuralink is helping you do are inspiring to hear. Um, I guess so. Just to recap the timeline a little bit, he said diagnosis February 21st, 2022, and
Yeah,
then
I would say my symptoms started like April of 21, and then I received the diagnosis of February of 22.
gotcha. And then I guess at the very beginning, you said that there was muscle twitching in your left bicep. Was
Mm.
that consistent in the sense that it was consistent every day that it would occur?
Sorry, that was my dog Joey. He was
That's
barking
okay.
at something.
Hey, Joey. Um, that it would consistently occur a couple times daily, or it was persistent throughout the day, every single day?
It was nonstop, 24/7. Even when I was asleep, it would still be twitching.
And
Um,
once,
sorry,
sorry.
go ahead. What was your question?
And once it started, it continued with the same severity.
It continued with the same frequency and intensity
Okay.
for the longest time. And then the twitches started to spread down my arm and in my hands. And that that's when the weakness kind of progressed, is when those twitches started spreading. And then it eventually moved bilaterally. So I eventually developed a twitch in my right shoulder and bicep as well. And it kind of took off from there.
And prior to you experiencing those twitches, it wasn't like you were getting some warning signs, like it would be there would be a twitch every once in a while. It's just once it started.
Once it started, it started. And like I remember telling it all my like close friends and family, like, check my arm out. Isn't this so weird? Like, what is going on? And never in a million years would I have thought that ALS would be the final conclusion or diagnosis. I had simply thought that maybe I pinched a nerve or pulled a muscle, or something benign that was going on. I never in a million years thought I'd be in a waiting room by myself and hearing that I have a fatal disease.
Gosh, it's such a terrible disease. Like I'm starting to know more folks, obviously you, Brad, and others who are participating in the Neuralink trials, but also others who will come up to me and tell me, like, I have a daughter who has ALS, or I know somebody who has ALS, and the thing that I am finding is that it consistently blindsides people and their families. So it like makes the disease even worse. It's just, it feels like it's the most awful thing out there. It's just terrible.
I mean, it's something that, traditionally you're taught, or you learn that, this is a disease that happens in older populations of people. And I think that's why finding drugs that are going to work is so hard, because it's hard to really create a sustainable and significant clinical research study when you have a population that's fading rapidly. So the time that you have with these people to start your trial is so short that you can never really draw any conclusions that are significant, because you're trying to capture data from an older population that, quite frankly, like, once they know they have it, it's kind of already too late, like they're kind of already on the way out, which is why, like, younger people such as myself, that was why my reasoning of really spreading awareness that this can happen to anyone, because I think we need younger people like myself to put their name in for these clinical drug trials, so we can try and get some significant data to try and find a cure. Because right now, I think it's just kind of, we're spinning our wheels and it doesn't feel like there's any real traction. And that's when I realized, like, medicine isn't going to find an answer for me in my lifetime. So if this Neuralink can make my life easier, and if I can help the next person that's in my situation, even if it's just 1% that I improve their lives, then all of it would be worth it, because like, the place that I was in that exam room when I received my diagnosis, I don't want anyone else to have to go through that. And if I can do anything to change that narrative or increase awareness to the severity and the terribleness of this disease, I think you don't really appreciate it until it affects you, or it affects someone that you love. And it doesn't just affect you as a person, it affects everyone around you. So it really is something that, the gravity of it, it's taken me a lot to get where I'm at now. Those early days after diagnosis were really hard. But like I said, like, Neuralink has given me this new sense of hope, this new sense of purpose, where I'm waking up and I feel like I'm attacking every single day, instead of waking up and being pissed off at the world and feeling sorry for myself. And I'm trying to create as much positive energy as I can, because you waste so much energy thinking about negative things and things that are completely outside of your control. So I really have tried to just, I can't control that I have ALS. It is what it is. But I can control my outlook on life and how I act and treat others every single day. Like, ALS can't take that away from me. So I try and use that mantra and live by that every single day. But I think Neuralink is going to help so many people that don't just have ALS, have other neurodegenerative diseases, that just giving a little bit of freedom back is like, it's like rewinding a clock almost. because like I used to be able to do all this stuff. You know, I used to be able to do it really well. And then I got to a point where I couldn't. And ALS has given that all back, and Neuralink has given all of that back to me, and that I can be independent and communicate independently for now, you know? So I'm going to use the voice that I have, what's left of it, to increase awareness as much as I can.
Yeah, and I think that's really special that you have that mindset and you're doing that. Like the fact that you became aware of the Neuralink trials because Nolan did interviews, and he talks about that frequently. He talked about that with me, that that's one of the main reasons, if not the main reason, that he does these interviews, is to just spread the word about Neuralink and about what's happening in neuroscience, and just get awareness so that other future patients can enroll, or more people can learn about neuroscience. I mean, there's just so many good things that come from just increased awareness of the good that's happening.
Yeah, I mean, like Neuralink for me, you know, the baseline objective was we're going to be able to move a cursor across the screen. And I remember when I saw that first video of Nolan moving a cursor across the screen, and to see his face and the reaction of like, it takes your breath away. Like I remember when they first kicked my Neuralink on and I had control of the cursor, it felt like flying almost. It's like a feeling you can't describe. And I wouldn't have known about any of it if, you know, it wasn't for Nolan and his bravery, and the other patients that stepped up and took the leap. And that's kind of what we're all doing, is taking the leap and trying to push the limits on what we can do with our brains. I think I'm blown away. Like I've had it for 2 months now, and I never thought I'd be doing the things that I'm doing now and working on the projects that I'm working on now with the Neuralink. And it's so much more than just moving a cursor across the screen. It's truly remarkable, and you know, I'm very lucky and fortunate. And it's weird to say that I'm lucky or I'm fortunate, but to be selected for this trial and to receive this incredible technology, I really am blessed.
And you did you drive or fly to Barrow?
So from Austin, we flew. Yeah.
Okay.
I got out there a week before the procedure. And then after the procedure, I stayed out in Phoenix for 2 weeks, for the incision and the staples to heal. And then I was on a plane back home to Austin. The recovery time was, for having a procedure on your brain, the recovery time was very minimal. Like I spent the night in the hospital, and then I went home that next morning. They gave me pain medication, but I just took, you know, ibuprofen for the most part, and tried, you know, not to really touch with it, mess with it, get it wet. But it was a very easy recovery for for what they were doing.
Sure. And can you describe that day, what the surgery was like, what you recall going into it, and then like immediately waking up and how that felt?
Right before heading into surgery for my Neuralink brain implant and going full cyborg.
Clear eyes, full hearts. You lose.
ALS may take a lot from you, but it can't touch this part of who I am.
Yeah, so my procedure wasn't until 2 o'clock in the afternoon. So I remember that day just kind of like anxiously pacing at my Airbnb, like, okay, when is it time to go? When is it time to go? Didn't really have much nervousness. In meeting with Dr. Ponce, I really had no nerves regarding, the procedure itself. I was just more anxious and ready to get things going more than anything. So arriving at the hospital that afternoon, the whole Barrow team was there in the lobby waiting for me to greet me. They took me upstairs, got me into a hospital gown, got my IV running and everything. And I didn't really have too much time after that to sit around and think about the procedure. The team was moving very quickly, and it felt like, I was hanging out in that pre-op bay for only like, I don't know, a half hour to 45 minutes before we were rolling back to the OR. And then I woke up, I guess it was about 5 hours later, I think was the procedure time. It was right around 5 hours. And I remember waking up flat on my back, just looking up at the ceiling. And, the team was there saying the procedure went very well. And I remember I was just like, all right, when can we turn it on? When can we like fire it up? And they're like, well, just rest today, and then someone will be by tomorrow before you go home, and we'll turn it on for the first time. And I remember the first time I saw that spike raster of all the signals going across the screen.
Here's the moment of truth connecting to the computer. Check out all that neural activity. This tech is honestly incredible.
I felt like I was in the Matrix. It was really, really cool to think that all of that was coming out of my brain, and all of everything that was going on real time. It was new to me. Like, I've read about BCI and I've followed the stories of the other patients, but like when you're experiencing it and it's personal to you, it really does kind of take your breath away. Like I was so shocked at what was happening, and it really didn't feel real. It was kind of like a surreal, almost out of body experience there for those first couple hours, because I've just been so used to hearing how shitty the rest of my life is going to be, and I finally like got this new extension of myself almost. And there's no drug in the world, there's nothing that can give me that feeling that like I had on that day. It was incredible.
Wow, that's really special to hear. And you talked earlier about like the impact on your family, and I know you have a son. Can you tell us more about him and the impact that he has had on your life?
Yeah, so my son, he's 6 years old. He's first grade now, just started this week. And it's hard to relate to a 6-year-old with the gravity of the situation that you're going through. Like he stands by and watches as my symptoms kind of progress. So he sees everything. But when I came home with this computer chip in my brain, as he calls it, and I was able to play Mario Kart with him, it was something I never thought I'd do again. Like you miss playing catch with your son, of course, but like even on a digital level, not being able to communicate or participate was so hard, because he loves playing video games, and he watches me work with the Neuralink team and he watches me and the things I can do with the Neuralink, and he looks up to me like I have superpowers, which, you know, for a dad, it's pretty powerful stuff. And I do all this for him, you know, because it's one day I want him to be able to look back and say that, you know, my dad fought tooth and nail, you know, every day and didn't give up and tried to advance and try and leave the world in a better place than he found it. Like that's mission critical, is like, if I can do something good that can help other people, then I want my son to have that example, and that people can try and define you and try and put you in a box, but nothing can replace your ability to fight for your own self and to create your own opportunities. And I want my son to be able to look back and say, you know, my dad did that.
And I'm sure he will. You know, it's hopefully maybe he will be inspired to even study neuroscience and or just be involved in the field of neurotechnology and learn more and help pioneer some of the work that eventually leads to something really special.
Yeah, I mean, the way he looks up to me now when I'm using my Neuralink, when I'm charging, he's like, "Dad, do you have your brain plugged in?" And I'm like, "Yeah." And you know, there'll be times where I'm like, "Hey, bud, it looks like you're getting sleepy. You want to go lay down and take a nap?" And he's like, "No, I'll just plug my brain in so I wake up like you do." And so he's the sweetest boy in the world, and he's so smart, and it's cool that I'm able to show him this technology, and that, you know, he goes to school, I know, telling all of his friends that his dad's a superhero because I have a chip in my head.
That's so great. And I love hearing that you're able to play with him. You know, like you said, it's digital rather than physical, but still it's I think that there's like a special connection through this tool. So that's really great that you've gotten to experience that. You also broke a world record for bits per second.
Hey everyone! I am thrilled to share some incredible news with you today. I just set the world record for cursor control using a brain-computer interface thanks to my Neuralink brain implant. This groundbreaking achievement isn't just a personal milestone, it's a leap forward in accessibility for so many people. Imagine a world where individuals with mobility challenges can navigate technology effortlessly, breaking down barriers that once seemed insurmountable. This technology is redefining what's possible, opening doors to new opportunities for communication, creativity, and connection. It's not just about speed, it's about empowerment and inclusivity. As we explore the potential of brain-computer interfaces, we're paving the way for innovations that can transform lives. I'm excited to see where this technology takes us next and how it can continue to enhance the lives of many. Thank you for joining me on this journey. Please follow to see more exciting updates. Your support truly means the world to me.
Yeah, so when you first get up and running with Neuralink and you calibrate the cursor, game we play is called WebGrid. So you have 3 different clicks on your hand. And so when you're playing Neuralink, different colored boxes will pop up and you need to navigate to them and click them to go away. and that's measured by speed and accuracy. And when I had first joined, in the first week that I had the Neuralink, I surpassed 10 bits per second of processing speed, which was a benchmark and a goal that Neuralink had set that they didn't think that would be surpassed for a while. So in the same week, I registered 10.16, and then a couple days later, I registered 10.60. However, I'm told that the video for the second speed, the file was corrupted, so I only had the video for the 10.16, which I think one of the other participants has surpassed. So there's definitely a competition, I would say, that's going on intramurally, I guess, between us patients. But it's fun to try to sit there and see, how fast you can get that speed up. And to think that I did that like on the first week, and that was a goal that Neuralink had set for that we won't hit for a while, just goes to show you how rapidly advancing this technology is and how we're surpassing pretty much everything that we thought was possible. And for me, when I joined this, my goal was, let's redefine what's possible and let's reimagine, what we can accomplish. And like I said earlier, it's to think I'm one of 9 on the planet that have this. It's like, I thought I had a better chance of winning the lottery than being diagnosed with ALS. And now the flip side of that coin is that also super rare was I was selected for this trial. So I do believe that everything does happen for a reason. And I believe that, I'm exactly where I'm supposed to be.
After you got the surgery, you were able to use the device the next day, and then how long can you use it before you have to charge, and how long does it take to charge?
Yeah, so for the first week after implantation, I wasn't able to charge because the charger does slightly heat up the implant, so they wanted to avoid that as much as possible. So for the first week, it's implanted with like 20% battery, I think. So for those first couple of days, we were briefly connecting to it, accomplishing the tasks that we needed to accomplish, and then quickly disconnecting. It wasn't until after that first week that they opened it up all the way that I could charge it from 10% all the way back up to 100. That process takes about 45 minutes to an hour, I would say, to charge it from like a low percentage all the way up to 100. And then that battery, I usually charge at night, and then so in the morning I have a fresh battery. And that battery usually lasts me till about, if I start at 7 in the morning, it will usually last till about 8 p.m. at night to when I charge again. So like, for instance, right now I'm sitting at 52% battery. So that 50% will get me to 8 p.m. and they'll probably drop down to around 15 to 20%, and then I'll charge it back up. The only thing you don't want to do is charge it while you sleep. That's a contraindication by the FDA. So yeah, usually just charge it at night, when I'm watching SportsCenter or something. The charging disc slides into a ball cap, and you just put the ball cap on, and it charges much like an Apple Watch, in that the sensor of the charger doesn't need to be contacting the implant. It can hover above the implant. So you just need to make sure that you have the charger positioned properly, and then you'll charge up 45 minutes to an hour.
Awesome. And you can charge while using it, right?
Yep, you can charge while using it. The chargers themselves they're wireless, so you plug the charger in to charge it, and then you plug the implant into the charger to charge the implant. But physically, you know, externally, there are no wires or anything protruding out of my skin or my skull. The implant is wireless. The charging process is wireless. There's no cords or anything associated with it.
And I know with Nolan, there were 64 threads with 16 electrodes each. And then for future patients, there's often been 128 threads with 8 electrodes each. Was that the case for you?
Yeah, so mine had the 128 threads. I'm not for certain which participant they started on that phase, so I'm not sure how many patients had the 128 and what number it started at. But I think I was one of the first. I think maybe, I don't know, maybe like patients 5 and 6 have the 128 as well. I'm not really sure. But yeah, I do have the 128 threads. And I imagine moving forward in future iterations, that number will increase as well.
Sure.
Yeah. It's like, I tell people it's like the advancing technology of a cell phone. You know, like you got the iPhone 14 or 15, you know, someone down the line is going to have better hardware, you know. So hopefully I can upgrade and trade in down the line somewhere.
Right.
I would actually like to get another implant on the other side. Since I'm right-hand dominant, the implant is located on the left side of my brain.
Okay.
And so that was like, after I got home back to Austin and I had my free reign, that was one of the first questions they asked me. They said, "So how's everything going? Do you have any questions?" And I was like, "Yeah, can I get another one on the other side?" So we'll see if I'm able to sweet talk them into that down the line, but I think that would be really cool.
Yeah, I know there's so many different ways that the freedom can be expanded, and that's one of them, obviously, with having multiple Neuralinks. And then there's also other additional trials that are going to be conducted with not only motor control but also speech restoration and restoration of vision. And then also there's the Prime study and then the Convoy study. So are you a participant of the Convoy study?
Yeah, so I've started working with the Neuralink team on the Convoy models. I've only been training on it virtually. I've not physically hooked up to it yet. I think that's yet to come. But I have been going through all the calibration and model building work with the team. So I'm familiar with how it works and everything. It's really cool. It's so awesome.
Awesome. Yeah, that's pretty sweet. I mean, I had thought previously that, like at the beginning, Neuralink was using algorithms that were designed or used in academic labs like for long ago, and they were reiterated on. But my guess is that if you have the Neuralink team working on developing algorithms like brain signal decoding algorithms from scratch, then you're going to get much better accuracy and efficiency. So, if you have the Neuralink team using some of the AI tools that have been developed today, then I think they're going to have a really tremendous decoding algorithm in the future. Yeah,
I mean, that team is incredible. every day I work with them, the next day they'll have something new set up for me, based off the data that we collected the day prior. So it's like these guys are working overtime and then some. And I feel like we're just making huge strides every single day, and it's really cool to be a part of. I mean, like, before all of this, before my diagnosis, I was just a regular guy, but bad shit happens to good people all the time, and good things happen to good people all the time. So it's like I went from almost like climbing from the depths of the hell to where I'm at now, and to have the Neuralink, and that experience, and just trying to do good and leave the world in a better place than I found it. Like I said, it makes every day a whole lot easier getting up and attacking the day.
Yeah. Having that purpose, that's just sounds so great. And then the whipsaw of emotions, just all of this happening quite rapidly, that's got to be also a big toll. So kudos to you for continuing to push and just do the best you can and help as many people moving forward as you can.
Yeah, I mean, like I said earlier, if time is my most valuable asset that I have at this point, I'm going to maximize it and try and do the most I can with what I've got, and just let go and let God, as they say.
And then with the Convoy study, did you, when you initially applied, did you just have to select an extra box that says, I also want to be considered for participation in the Convoy study?
I think it was more of a conversational thing. I think before they bring the physical robot to my house, I think that's when I'll actually be officially enrolled and everything. But I haven't filled out any consent paperwork or anything. But I've just been training on the virtual models on my laptop, and it's really cool when you get it well calibrated and have the 6 different degrees of motion, and working off of that to help move things around, or just help grab onto things that I would normally drop. That's the biggest thing now, is that I'm so scared of attempting to do anything, because either I'll make a mess, break something, or hurt myself. So being able to do simple around the house things without having to think of any of those things, hurting myself, breaking something, or causing a mess, I can't wait for that. But yeah, hopefully I get to play on the actual physical robot arm soon, because doing it virtually has been a lot of fun.
Cool. Elon's talked about pairing a Neuralink with a Tesla Optimus robot. Is that something that I assume you're very excited for?
Oh,
what are
yeah.
some of the other, that, and what are some of the other potential things that are you excited about?
The Optimus robot was one that I was really excited about. I was also talking regarding other external devices, one of my hobbies one of my former hobbies, I should say, is I have a drone, so I like flying my drone around. And I was talking what if we could control this drone, with the Neuralink? And in theory, I don't think it's too far of a stretch, but the practicality of the regulation aspect of having a flying external device with other aircraft in the air. I think they'd have to do some serious work on the regulation part, but external devices, I think, is what I'm most excited about, like the Tesla robot. And then, my next door neighbor drives a Tesla, and he's like, can you log into my car and like use my car with your brain? And I'm like, I don't know, same manufacturer, kind of. So I don't know. It's cool to think about all the things that could be and what could happen. But in the interim, like in the current day, just working on the projects that I'm working on now, like developing a typing program. So picking and pecking at a keyboard is something of the past. Being able to imagine the keys on a keyboard and just have it type the letters then versus like actually pressing them is going to make me so much faster than I already am with this. And so I'm really, really excited to see the final product on that. But like I said, every day it's the scientific method, right? Try a bunch of stuff today, see if it works. And then tomorrow, if it doesn't, we'll modify what we did today and just keep on pressing forward. So I've been having a lot of fun. I mean, I never really even got this much excited about like being in school, but like I do feel like I'm going to Neuralink school every day, and it's just like, wow,
Yeah, now it's so real, and you get a chance to be talking to these fantastic engineers who are working on it every day. What is that communication like? Are you talking to them for a couple hours, and then are you doing this in person or on Zoom?
So our daily sessions virtual, like Google Meet. We'll meet for 2 to 3 hours a day. A lot of it is me working through tasks that they have, but a large portion of it is them collecting feedback because they don't have an implant of their own, so they can't possibly understand, what it feels like, or how is this challenging, is this easy. So like our feedback is valued like gold because they obviously don't know any better. And so I feel like, when I do give feedback, it's definitely heard and, put into application. Like a couple of things I've given feedback on, they've already applied into the models that they're using. So that's really rewarding, like, having your feedback like actually considered and listened to. And they don't know what they don't know. And so it's like they need us to really give feedback on anything, whether we think it's something small or just give feedback on anything, because that's how you make this thing better. It's just constantly getting feedback. So a lot of the meeting is application and me working on things, but then we spend quite a bit of time just in casual conversation about how is this working? What do you think if we move this over here? Or how does this feel? And it's real time. It's they're taking my feedback real time and then putting it into application for something else. So that's really a gratifying part of the experience.
Are you able to provide an example of something that you've given them that they've implemented?
Yeah, so part of the typing program that we're working on, the keyboard is divided. Keyboard has 3 rows of letters, so that's divided upon each finger, going across the keyboard. And I had recommended some color changes, so like highlighting where the left hand is versus the right hand, and just making distinction on, okay, when I was trying to type out this exercise, it was a little difficult to figure out where I need to be on the keyboard because it's all in black and white. What if we made the left hand and the left fingers this color, right fingers this color? And it did improve like my ability to, my typing speed increased after that, because I was able to distinguish things a little bit easier.
Awesome. And when you're thinking about typing, are you thinking like move left pinky up, or are you thinking more general, like I want to move the cursor up and to the left?
Yeah, no, it's just like if I wanted to type a Q, the letter Q, for instance, that would be my left pinky. So the intended motion that it's calibrated to is me sticking my left pinky out. So when I first started calibrating, you're going left pinky out, left pinky out, left pinky out. But then when I'm actually applying it in like a typing exercise in like a Word document, all I think is Q at that point. Because the intended motion is now, I've learned it in my behavior in my mind. So it's really just like, it feels fluid, like I'd be typing normally, I think of myself as I was always a pretty quick typer, and never really had to look at a keyboard. And so slowly but surely it's starting to become that fluid where I'm not just thinking a word at a time and trying to get that out. I'm processing and typing back full sentences like in real time.
That's pretty sweet. Yeah. I mean, I think earlier when we were talking about the bits per second, like that bandwidth is going to continue to increase and far surpass what I could do, like, I think even now, like whenever I try to play WebGrid, I'm not reaching above 9 consistent. I'm not reaching above 10 bits per second consistently.
Yeah, I mean it's a tough feat for, I guess, people that do not have any disability or handicap at all. Like, it's not an easy task. Like, and you have to be accurate as well. Right. So, I've gotten a little frustrated. I'll be playing WebGrid and like, I had to turn the scoring off so I can't see it, because if I see the number, I'll like go into panic clicking mode and then I'll start making mistakes. So I turn when I know that I'm getting close, like 9 or 10, I just try and like hyper focus on what I'm doing. But sometimes that even makes it more difficult. You really need to get into almost like a flow state where you're not even thinking about it. It's just, it just flows. And that is what I think they're like, so do you think move cursor from right to left? And I'm like, no, it's the same thought process that you all go through when you're trying to move your mouse. I don't even think about it. I just look and it's moving. And it's, my brother actually was over at my house the other night, and I was showing him all this different stuff that I was working on, and the whole time he's like looking at my hands to see if I'm moving anything at all. And he's like, so you really are just driving that with your brain? And I'm like, yeah, that's what it's intended for. So it's really cool when people see it for the first time, because it really is a holy shit moment for them. Like, wow, that's incredible.
And I think, it's weird because like now I've had this channel and this podcast and talking about Neuralink, and I'm around, I'm thinking about it often. And there's the initial shock where you have the holy shit, like I can't believe this is happening. And then it kind of fades away and you get normalized and used to it. And then like every once in a while, something will click and I'm like, wow, this really is insane that this is happening. Like you and the others are literally just like, all right, we're just gonna like, we're gonna like touch type and use like a touch screen, but like the next level of that.
Yeah, and what's crazy to me is like how the models in the background are able to recognize what the intent. So like for typing, for instance, if I'm trying to use my left ring finger, which is one of the fingers that I have the least mobility with, like if I'm trying to type a W with my left ring finger, I'll make a mess of it, and it will type a Q, an E, and it'll type all the letters around it. But as the model learns, it learns to take away all that noise and just recognize what I intended. So the next time I try and type a W, it's going to know, as messy as it is, this is what he's trying to do. So that's the biggest thing to remember when you're calibrating. It's like the intended motion. So if you intend to move your thumb up, in, or out, you can hit other things on the way, but as long as that's your intention, the model's going to recognize that and decode all that noise and pull it away. And at the rate it updates, it's crazy to me.
And you're recalibrating every day, but it's also like getting a little bit better every day and remembering some of what you did the prior days. Is that correct?
Yeah. So you can calibrate for, if you calibrate for a longer time, that model and your cursor control is going to remain more robust for a longer period of time. Now, if you calibrate for just a short time at maybe a higher gain or speed, you can calibrate for performance where you'll be lightning fast with your cursor, but there's not a lot of data in that model. It's not going to, the performance will kind of start to decay over time. But yeah, I usually just calibrate in the morning, and I'll calibrate for 20 minutes or so, and that is sustained control for the entire day. Now, if I go a couple days without calibrating, which is super rare, then the control might kind of be a little bouncy, a little bit all over the place. But it's funny, like you can have very little control when you start calibration, and oh, I just did something. Hold on. Pause. Exit. Yes. Sorry, I picked up one of my voice commands.
That's okay.
I forget what I was saying, but the calibration on it, if I usually do it about 20 minutes in the morning, that will hold up for pretty much the entire day. But the more data you have in your model, the longer and more sustained and robust your control is going to be.
Yeah, Nolan had told me in our interview that like how he's positioned away from the screen will impact how he calibrates. Is that the case for you?
Yeah, I mean, it will calibrate differently. Like if I'm sitting in this chair and I calibrate and then I try and go lay down on the couch, my control is going to be different because when I calibrated, I'm sitting in the chair. But there's times at night, like I usually have the laptop up close to me like this, but there's sometimes at night where, I'll just kind of have it, I'll be wanting to watch TV, so I'll push it aside. And I can control it from pretty much across the room. Like I can calibrate sitting in the chair or laying down. And that control will like I can control it from across the room. But if I leave the room, like if I go into the kitchen or the bathroom, it'll disconnect if I get too far away. But yeah, control. You always want to try and calibrate in the most like optimal and most comfortable sitting, because then you're just going to have better control that way. I pretty much sit in the same spot every day, so I don't have too much variability about it. But yeah, I have noticed if you're sitting in different positions or have your hands located in a different position or crossed or folded, it will calibrate and your control will be slightly different. But yeah, I think that answered your question.
Yeah, I like, it's kind of interesting to think about that. If I'm here oriented in front of the screen, then I I can visualize it, and probably the way that I think about moving a cursor around the screen is, it makes sense that it would be different than if I was sitting right here. But I guess when I'm thinking about the Neuralink, like, I feel like it should eventually get to the point where it's robust enough to like do that recalibration on its own. But
Yeah,
who knows?
yeah, and I think it could very well get to that point. The models are always updating, so like you said earlier, the more data that goes in, the more robust it is over time. So the data just builds on itself day after day. So yeah, an auto calibration I think would be something that I don't think would be too hard to figure out.
Okay, so I have a couple more questions. The first is there something that you think people should know more about Neuralink that they don't currently know, or is like the most underestimated thing about using the device?
Well, I'll start with I think the biggest misconception about Neuralink is that it restores physical mobility. So like when I was telling people that I was getting the Neuralink, the first question was, "Oh, so will that mean you'll be able to move your arms again?" And so the biggest misconception is that it aids in physical movement, which would be awesome if it did. But right now, it's just a means to use Bluetooth to connect to devices to make communication and technology more accessible and easier for the end user. I would say the thing that's most underrated about the Neuralink is everything about it. I think that at face value, people see it and they're thinking, okay, cursor across the screen. Cool. And when in reality, like, it's so much more than that, that when people actually see under the hood and see how it operates like real time, the reaction has been, holy shit, this is awesome.
And then, is there a message that you'd want to share to the audience, which is, it's a global audience? Some folks are going to be future patients. Some people may join Neuralink in the future. There's current Neuralink employees, current patients, and people interested in technology, and then other people who are interested in the medical applications. Is there a message that you want to share with them?
I would say that we're not able to figure out what we're really capable of unless you have those individuals that are willing to step forward and to take a chance and take a leap on something that is considered investigational. this technology, when I first read about it, my initial thought was like, what could happen? Like what I was envisioning, like a Black Mirror episode, you know, like when brain chips control people. And I think that's a misconception about what the Neuralink actually does. And they're saying, oh, does this mean that they're reading your thoughts all the time and people can look straight into your mind and understand everything? And the reality is no. Like when I first met the Neuralink team and the Barrow team, I was immediately put at ease. It made me feel like this was so routine to them that they've done it a million times. And truthfully, like they performed and executed the procedure like it was routine. So the fear of having an invasive brain procedure, I really checked all that at the door, because once I met Dr. Ponce and the team, I was so comforted that, you know, the whole brain surgery aspect of it was kind of put out of mind. I was more thinking about, okay, when I wake up, when can we get started? Like how quickly after the procedure can I start using this? So I would tell people that are interested in the technology, interested in the implant, is like, don't be afraid to reach out to people that either have the implant, or don't be afraid to seek out more information. Because I think once you start researching the Neuralink even more, you're gonna realize that there's such a badass team behind this thing. And there's so much horsepower that all the participants are coming with and engaging with every single day. And so we are, as participants, trying to do everything we can so it becomes a viable product that people can use in hundreds of applications that we haven't thought of yet. So my advice to people would be like, don't be afraid to take a chance, because no one ever accomplished anything by playing it safe. You know, risks have to be taken if we want to achieve something greater than ourselves. And just enjoy the scientific process of learning what it can do and learning how the data is decoded. Like, I nerd out with engineers because it's something I come from a medical background, so I have no engineering skill set at all. So like the amount of information that this team comes equipped with every day, they're so badass. So like my experience with Neuralink has been nothing but positive, encouraging, and full of hope. Like, honestly, Neuralink gave you my hope back, which was when it's robbed from you, you think you'll never be hopeful about anything ever again. So for those people who are losing hope or have lost hope, I would say just keep fighting, because there's things out there like Neuralink that we're going to get there. We're going to get to a point where we can make people's lives easier. And like I said, if I can change one person's life for the better, then everything I go through will be worth it.
Hey, before you watch the next Neura Pod video, I wanted to share some of the things that Jake has shared on X. He posted, I set the world record for cursor control with a brain-computer interface using my Neuralink brain implant. And this is the video.
Hey everyone! I am thrilled to share some incredible news with you today. I just set the world record for cursor control using a brain-computer interface thanks to my Neuralink brain implant. This groundbreaking achievement isn't just a personal milestone, it's a leap forward in accessibility for so many people. Imagine a world where individuals with mobility challenges can navigate technology effortlessly, breaking down barriers that once seemed insurmountable. This technology is redefining what's possible, opening doors to new opportunities for communication, creativity, and connection. It's not just about speed, it's about empowerment and inclusivity. As we explore the potential of brain-computer interfaces, we're paving the way for innovations that can transform lives. I'm excited to see where this technology takes us next and how it can continue to enhance the lives of many. Thank you for joining me on this journey. Please follow to see more exciting updates. Your support truly means the world to me.
Right there, at 10.08 bits per second, he set a world record. And as you can tell with this next post by Nick Ray, who's the 8th Neuralink patient, he says, "I don't want to burst any bubbles, but," and then he shows him getting. After this, Jake actually quote posted this saying, "Nick, that's so awesome. I broke my score again, but we didn't have a video of it. Lol. I think I got up to 10.6. And then Nick responded, "Pixar, didn't happen, man. 10.6, I'm coming for that tomorrow. Let's go." So obviously there's this competition between them amongst all of the patients trying to reach the highest bandwidth. Bits per second is a good way to determine the speed and accuracy, or to measure the speed and accuracy that they are controlling the computer cursor. Whenever I have used WebGrid, this game that they're playing, on Neuralink's website, neuralink.com/webgrid, I will play the game, and usually I'll get in between 9 bits per second to 10 bits per second. Oftentimes I'll get below 9 bits per second. So this is an indication that, Neuralink right now is enabling patients to control a computer more seamlessly than an able-bodied human, and that separation is only going to continue to increase. Eventually, people who have a Neuralink will be able to play video games much more seamlessly than those who do not have a Neuralink, because they'll be able to operate their controls at the speed of thought rather than the delay from converting thoughts to actual action or movement of a controller. Okay, on August 12th, Jake posted this. "Some charge their car, I charge my brain. This is what charging my Neuralink brain implant looks like. A disc slides into the beanie that plugs into the rechargeable silver base. I just sit back and relax." So his beanie connected to this silver base. And then another post. This is an incredibly powerful thread that Jake posted. He says, "I'm 34. My mind is sharp. My body is failing. ALS doesn't care about age, dreams, or plans. It just moves in and takes everything. Here's what living with it is like." And he shows this picture with his dog. Obviously, he looks like an extremely normal, it's very unexpected that this would affect somebody like him. "I thought ALS was something that happened to older people, then one day my arms were weaker. I had trouble lifting things. Months later, I heard the words, 'You have ALS.' It felt like being dropped in the middle of the ocean with no land in sight. Every month, something else gets harder. Buttoning shirts, holding utensils, walking without stumbling. ALS doesn't stop. You adapt or you lose pieces of your independence." And a fantastic picture with him and his son. "The world sees the wheelchair, the frail body. What they don't see, the mental exhaustion of planning for decline. The grief for things I can't do with my son. The pressure to make every day count. Friends don't always know what to say. Some drift away. Family becomes your lifeline. My son is my anchor. He keeps me fighting for more time, more memories. I'm one of the first 9 people in the world with a Neuralink brain implant. It's not a cure yet, but it's a bridge. A way to keep communicating even as my body shuts down. Hope is a powerful drug." ALS is 100% fatal. Most people die within 2 to 5 years of diagnosis. There is no cure, but there is still life to live. I refuse to let ALS define all of me. I share this not for pity, but for awareness. ALS research is underfunded compared to other fatal diseases. Every voice matters in pushing for change. If my story moves you, share it. Be part of the fight. ALS is trying to take my body. I am using my voice while I still can. If you want to follow my journey, the science, and the fight for a cure, stay here. We're just getting started. Do Jake and I a favor and follow him at pairedwith_P7 on X and on these other platforms, including Instagram, YouTube, TikTok, and X, that also have the same username. Thanks for watching, and check out this episode to learn more about Neuralink.